Taoiseach, at the start of this year, a major incident was declared at UHL. Because of the number of people presenting in the A&E there. In response, a protocol was agreed whereby a very limited number of patients could be brought by ambulance to Ennis instead. And the meeting was held on the 17th of January with the Minister for Health, senior HSE management and the management of UHL and Oireachtas members from the area. Your attendance at that meeting was noted and very welcome, Taoiseach. The acknowledgement by UHL management, or by HSE management, that UHL's Model 2 hospitals, such as Ennis, Nenagh, St John's, that they were underutilised was very welcome. At the meeting, I asked what additional resources would be provided to Ennis in light of the new protocol. I was told a review would take place, and it was implicit in the reply that those resources would be provided. Instead, all surgery stopped at Ennis for the month of January. 2 newly equipped theatres lay idle. Specialist staff were redeployed across the hospital. I raised this issue of under-resourcing of UHL with the Taoiseach, your predecessor, Micheál Martin, when he was Taoiseach. I agree with him, it's not the Taoiseach's job to run a hospital, but it is the Taoiseach's job to ensure that hospitals are adequately resourced within the constraints of national finance, that hospitals across the state are equally resourced, because UHL seems, on any of the figures, to be understaffed relative to the population of the region and relative to other regions in the country. And it is the Taoiseach's job to ensure that the existing resources are adequately managed. Now, Taoiseach, I ask you, are you happy that the Midwest and the UHL Hospital Group is adequately resourced relative to other parts of the state? And if it is adequately resourced relative to other parts of the state, are you happy that those resources are being adequately managed?
Thanks, Deputy. What we want to achieve in healthcare, guided by the Saunte Care Plan, is essentially 3 things. We want healthcare to be affordable, free at the point of use for a lot of people, affordable for everyone. We want there to be access, people getting healthcare in a timely manner, and we also want there to be good patient outcomes. And I'm not satisfied with where we are with regard to that as a country, and I acknowledge that we have a lot more work to do, and not just in the Midwest region, across the country as well. And people will bandy about a lot of different figures as to which region has the most beds or the least beds or which budget, and I'm not sure we're always comparing like for like when we do that in that regard. But what I can say is since December 2019, roughly since this government took up office, we have seen a very big increase in investment in healthcare. University Hospital Limerick, for example, has grown its workforce by over 1,000 staff since then. So just in the last 2.5 years, more than 1,000 full-time staff added to Limerick Hospital, and its budget has increased by 20%. And as you'll know, there's a 96-bed inpatient ward block now under construction in Limerick. Minister Donnelly only turned the sod on that back in October, and as I've indicated before, we need to start planning for further bed expansion in UHL because it's going to be needed. In relation to Ennis and Nenagh and St John's, there has been a shift in policy. Our ambulance service is different to what it would have been 10 or 12 years ago, and we believe that we can safely now bring patients directly to hospitals like Ennis and Nenagh and St John's if the patient is stable. And that makes a lot of sense for a lot of reasons that I don't need to explain to people here in the House. Unstable patients, severely ill patients going to the emergency department in Limerick, but those that may be sick but stable going to Nenagh, going to Ennis, and we acknowledge that that will require additional resources in those centres if they're going to see additional patients. The medical assessment unit pathway for Nenagh came into force on Tuesday the 7th of February, and the pathway for Ennis Hospital came into operation on the 9th of January. And the new pathway allows stable medical patients meeting agreed clinical criteria to be treated in the Model 2 hospital rather than having to go to the emergency department in Limerick. And we think that will make a positive change for the difference. It's also envisaged that similar measures will be introduced in St John's Hospital in Limerick in the near future.
I hope it will make a positive change. But the change that it did make was the cancellation of surgeries in Ennis. 2 theatres lying idle, specialist staff being redeployed. There's something very badly wrong with the utilisation of the Model 2 hospitals. Now, you talked about figures, and the Minister for Health talked about 1,000 people in the UHL hospital group. I received other figures yesterday saying that just 60 of the 3,000 odd whole-time equivalent positions created in 2022 were in the UHL group, notwithstanding the fact that it's the most consistently overcrowded hospital in the country. This time last year we learned that there were no additional beds to be provided there, despite the fact that they were being provided in other less crowded hospitals. This has an impact on real people, Taoiseach. I have a letter from a 78-year-old who went to Ennis, presented and was told that because there wasn't an orthopaedic consultant available, she had to go to Limerick. She was in a trolley in Limerick for days. Now, just another statistic, I know, but a real life affected by the fact that we're not utilising our Model 2 hospitals in the region to the extent that we can and should.
Taoiseach to respond.
Thanks. Thanks, Deputy. I don't know exactly why surgery was cancelled in Ennis during that period. Mr. Donnelly's here beside me, has said that he will check it out. It could be the case that the hospital was simply full of medical patients. That happens. It particularly happens during the winter period where the surgical wards have to be given over to medical patients because so many people are coming in with pneumonias and coming in with respiratory infections and other things, and that's why surgery is sometimes cancelled. And that's one of the reasons why, for example, we want to develop surgical hubs and elective hospitals. And you'll know what's happening in Croom, for example, where there's elective care only and managed care. And to be honest, it is one of the risks of using the MAUs more in Ennis and Nenagh, is that if more medical patients are taken directly to Ennis and Nenagh, there is a risk that surgical beds will be taken up by medical patients, thus requiring surgeries to be cancelled. So that's something we always have to factor in. And it's one of the reasons why we're moving towards surgical hubs and dedicated beds.